Hello guys, and welcome to the next episode of Let's Play Project Hospital, where we have some very exciting times right now. Because, as this title is saying, let the surgery begin. So last time, without, out of the blue, we had to end up creating a surgery room, an operating room, because one of our customers, one of our patients actually needed a surgery, and I didn't want to send them away. Now the good thing is that when we create, it was in neurology, which already has hospitalization. If it was somewhere else, it would have been impossible. Now, the good thing is that when I set up hospitalization, it necessitated you had to have enough uh, doctors, surgery nurses, somebody who could operate and everything. So that was a good thing. Now, before we start, as you can see, our patient is already on the bed, laying down in his full clothes without any drapery or anything, which is kind of, I don't know if it's really sanitary or whatever, but anyway, let's quickly see if we have anybody waiting for us. Look at that, still a ton of people in the hospital. It's already 2:30, so actually you have to pay attention to that. Waiting for player is Jennifer Cole. Okay, let's get rid of everybody else right now. Daniel Hernandez is our person who is gonna be having an eye surgery. Actually, the eye surgery is already underway, apparently. We're still gonna do a tonometry later, but I think just when he's on the hospital, so never mind. Waiting for player, not more. Nobody's in the ICU here. Nobody's waiting for me. Nobody. That's good. Sarah Harris is also waiting for us. Actually, you know what? I'm gonna handle her first because it's very... Oh, we already did that. We basically handled it over to Nancy Cole. Wait a minute. Nancy Cole is not our doctor, right? Oh, it is. You know what? I cannot just handle her over like that. Sorry. We're gonna take care of her. Almost screwed it up. So that one we have to give her eye drops, recommendations, and analgesics, I believe. No need for hospitalization, and the rest is nothing. So we almost messed it up. Messed it up. We have to make sure that we have all the treatment we are giving her. Okay, so that's taken care of. And here, nobody. All right, so we're good. Let's go and quickly Jennifer Cole or Sana Harris. Where are you? Okay, I'm gonna put you there. Jennifer Cole, you have abdominal pain. Okay. And we already did physical, abdominal, and temperature. Let's first get this out of the way, and then we can actually see the surgery itself. It can be a ton of things, again, like literally a ton of things. Let's do... abdominal pain. What can we do with that? We have like a ton of different things. I cannot look at these, what is available, because that's way too much. Okay. So we already checked the temperature. Okay. Let's do a CRP, because that's going to determine if it's something, it has an inflammation or something like that. Okay. Let's do speech listening. I'm not sure, but actually there are some that is saying that. And let's just simply do a chest auscultation so that we see. I'm not sure. I think Do I even need? Yeah, there are some things that would need chest auscultation. No, that's somatics. I'm not even sure chest auscultation would make any sense. I would guess it does, actually. Yeah, there are. You see, like this one. So I think there is, but right now I'm not sure what else. Boom, 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 boom. I don't even know what else we can do that is simple. I don't want to do a stool sampling and all other crazy stuff right now. Okay, we're just gonna do these simple things. Okay. And then let's go back to Daniel Hernandez and let's actually watch our first surgery. So I'm gonna go down to, I'm gonna just use slow mode. And we're gonna see what's happening. Okay, it's like doing that. That's kind of funny. Okay. Lisa Young, don't bother us right now, but actually let's quickly do what do you want. You have viral tonsillitis. What else can you check out of you? Let's do a physical. Let's do a temperature test, no need. You already have observation, anti-reflex, rest, cough suppression. You can have a oral cavity. It's going to interrupt our surgery many times because we are at the same time treating pretty much everybody here. Okay, so oral cavity is going to give you NSAIDs. The neck palpation and physical basically could give you analgesics. So I'm not even doing a double. Ear exam would give you the same thing. Let's do a nasal cavity inspection. And I think that's pretty much it. So what is happening? Two people are still there. I don't know why they are standing there. Performing eye surgery, but they are hiding behind the wall. I don't know. That's kind of weird. Okay, Nancy Martinez is actually in the hospital. We already know that he has irritable bowel syndrome. And he's hospitalized. So what I'm gonna do it, I'm not gonna let the doctor, I mean, I could actually, probably I could the doctors just handle it. Thomas Anderson is not my doctor. Since it's in general surgery where we have hospitalization, if they handle it, I think it should be okay. But let me just handle it just to make sure. Let's him give the diet modification, some pain medicine, vitamin supplementation. Yeah, let's give him that too, even though not really necessary. Yep, and just keep treating him. All right. So let's see what's gonna happen here. Still don't know what is. Come on, poison ivy, sunburn. You decide. Only the physical examination came up with something. With poison ivy, we would have chest auscultation, didn't show anything. Temperature didn't show anything. Evaluation. Let's do an evaluation. I just want to get it out of the way. All right, 4 people in there. Somebody's monitoring the. I mean, this is a brain surgery after, and look at that. It turns out she has poison ivy. That's perfect. So you just, Jennifer Harris is not our doctor, I remember. So let her just handle it. So actually one thing, the problem is that our surgery, neurosurgery is 21%. I don't know how these things are going, you know. Oh, Lisa Hill, he's just his doctor, she's just her patient, but Lisa Hill doesn't need a, what is it, a surgery, so we are fine. So she only have 21 in neurosurgery. I hope that it's not like a little chance game, like, yeah, they screwed it up. Sorry, the patient died. I mean, it could be because that's what really happens in real life, doesn't it? So I wouldn't be even that surprised. All right, so broken ribs. What can you do? Mark Johnson is not our doctor. What else do you have? Really nothing we can do, so we're just going to confirm and let him treat. Okay? And let's see, do you need an ice wrap? No, because it's a low thing. All right. Come on, guys. I'm trying to watch what's going on in the surgery, and you guys keep interrupting me. That's really not good. Robert Davis is going to the lab, but we already know that he has kidney stones. He might have some of the problems. Abdominal palpation would give him some pain medicine. He already gets them because he has some, okay, urinating problems. Physical, we already obviously did that. He has actually some fever, so we're gonna give him the antibiotics, right? So there is nothing else we can do, basically just treat him. But let's pay attention what you give him, because you know what? Before it goes anywhere else, let's make sure that gets the stomatics, antipyretics. Actually, it's antipyretics. I always say it incorrectly. Sorry about that. Antipyretics is basically fever medicine. So get off my back. Um, we're gonna have some pain medicine. Recommendation, rehydration, no need. We're already giving him. Okay, the rest, I mean, he's gonna have some shockwave lithotripsy. He's gonna get that, no worries. But I just gave him what he really needed. And let's go here. Oh shit, hold on. Sorry. I just accidentally, that's Lisa Hill. No. Nope. No. Okay, sorry. Just get rid of all these people. Nancy Martinez is, yeah, he's gonna get the treatments. Lisa Young, I don't care. Oh, what? Back to game. Sorry, wrong. What the heck is happening, guys? Okay, sorry, I made a mistake. I accidentally clicked on something. Here you go, waiting for player. Elizabeth Taylor and Robert Hall is both waiting for player. I accidentally just clicked on OK, and that's not okay. Because I did a little test the other day, and I think I told you guys already that I did a little test, and I had like 12 people or something, and they were like waiting for me, and I just kept just saying, okay. And they waited until the next day before they started to complain that, it's been too long, maybe I'm going home. I was like, what are you, like, you know, like Forrest Gump, like, I am tired now. I might go home. Okay, so actually we already gave him physical and differential. Why aren't they do it? Why don't they do it? Oh, because he's walking around. Okay, he has to actually get in there. So this one is fine. And she is, okay, this is the one that we have to take care of. Okay, chronic kidney disease, I believe you gonna, oh, dialysis. That's not good. Um, it might need actually also hospitalization. That's, I'm not sure. But we should send her over to general surgery. And over there, let's see, he's got to have some physical, obviously. Interview, interview. Blood test, that's all it turns out that. Okay, let's do a blood pressure. Where is the blood pressure, people? It's so easy to miss it because there are so many, and it's just a very delicate. Blood draw, blood analysis, no. What am I missing? Page 2. Oh, here you go. Blood pressure, there you go. And let's see what else. Physical, obviously we do that. I mean, that goes without saying, right? Physical. Although I'm not sure if I really need it. We're gonna do a speech listening. We don't need a CT. We, it would be nice, but it doesn't really need that. And I don't need that. Okay, so we're just gonna give her these kind of things first. Elizabeth Taylor. Okay. And now we're gonna get back to our patient. What is going on? I don't know why it had to be turned off. Oh no, hold on. One down there and it's here. Let's go back to our favorite patient. Look at that. No, not you. Sorry, Margaret. No need. Look at that. He already got the mask on him. Okay, and let's go. So are they gonna... I don't know what they are operating. Like, it's supposed to be a brain surgery, isn't it? What kind of... It's an eye surgery. It's an eye surgery, but his eyes are... He's still wearing glasses. So you have an eye surgery and you are under surgery and you are wearing glasses. Right. Okay. Okay. I'm learning every day, guys. I'm learning every day. That seems to be a perfectly normal procedure, so fine. Now I have to pay attention. It's 2:41. I think by about latest by 4 o'clock. You remember, I have to make sure that everybody is sent to their respective, if necessary, going to some hospitalization or something. Otherwise, we're going to be a Wait a minute, we have 8 people in hospital? What on earth happened? So when I told the doctors to hold on, why do we have 8 people in hospitalization? Paul Harris. Okay, I put him there because he's the one who collapsed. Fine. John Scott, Rudy Johnson. Okay, so these 3 are fine. Okay. Nobody in ICU, luckily. Here, Frank Anderson. Okay, apparently I did that. Oh yeah, this is one of our old patients, I believe. Yeah. Nancy Martinez. Why do you put him into hospital with that? Just give him the... Okay, so apparently my doctors, they just decided, you know what? He needs to be in hospital. I didn't tell you that. Shockwave lithotripsy, the same thing. He already done that, and they just put him into... Oh, okay, so apparently I have to control them until the end, because this is crazy. He's doing the interview now? Are you serious? What is going on here? Wait, wait, wait. He is actually doing an interview? What? What room is this? This is the sonography room, isn't it? Yeah, it is the sonography room. What kind of interview are you doing In the sonography room. No, I think he just did the shockwave lithotripsy, right? But I didn't tell you to go to hospital. Okay, guys, I think change of pace here. I have to change a little bit because they're gonna fill up my hospital so quickly I won't be able to say a word. So apparently, if there is a hospital room, they just gonna send everybody to the hospital room. I don't want that. I need the space. Look at that. Lisa Hill and Daniel Hernandez. Okay, this is fine. This is fine. They need to be there. Okay, so I think a little change of things. Okay, let's go back again because I don't know if there is anybody waiting for me. Robert Hall, we did that. Kate Young, we didn't wait for. Okay, wait for us. Look at that. This was the one that actually we looked at, right? So what do we have? Kate, we have iron deficiency. We already know that anemia. Thorax percussion would give you some pain medicine. Okay, actually, let's do a physical. That's much more useful. Diet, no need, no need. Okay, so Kate Young, you're okay. Let's stop for a second though. So yeah, I know these three. I know those was 5, 6, the one in the... Okay, so basically, apparently, they just sent one more patient that I didn't expect. So far, not a big deal happened. But really, this person didn't need to go there. Irritable bowel syndrome doesn't need hospitalization, as far as I'm concerned. Maybe I'm wrong. So that's all right. If she's happy about that, I don't mind, but she's clogging up the place, you know? We're not going to have enough place for our some other more needy customers. So I don't like that. All right. Anyway, so let's go back to Daniel Hernandez. Let's continue your surgery, sir. I think we're good. Jennifer Coase. I have to pay attention not to, not just release it to the doctors. Apparently, I have to really do it all by myself. Otherwise, it's going to be everybody goes to the hospital. Abdominal pain, we already did a whole a whole page of different things and nothing happened. We did the CRP, nothing. We did the speech listening, there was nothing. So let's do something more. Let's do something more to the point, okay? Let's do some microbiome sampling for sure, CBC sampling, and let's do stool collecting. No need for that, I think. Okay, let's just try that. Rachel Barkley, poison ivy rash. Okay, we know that for sure. We even did a chest auscultation, and he does have physical that. No problem. Let's finish it up. Lisa Hall, I believe she is our doctor. Okay, somebody apparently is in danger. Paul Harris, yeah, I know. He is in trouble again? Come on. What do you do? You gotta give her some steroid creams, bronchodilators, antipyretics. No need, no need, no need. Okay, that's all you give him, and I'm gonna just let you do it, and I'm not gonna release it to the doctor. However, hold on, I want to check on this guy here, because it seems that he's still getting some. Okay, hold on. So white, there's no white. All right, I don't know what's going on here. Oh, hold on, what did I miss? They opened his chest. Are you serious? He has an eye surgery, people. They cut open his chest for an eye surgery. You're killing that man. Come on. Oh, they finally finalize the defibrillation. That's what happened here. Okay. Kate Young, what's wrong with you? I already told you, just what is going Oh, did the physical and nothing happened. Okay, gotcha. So what else do you have? Thorax percussion could still give you because you don't have right now any pain medicines. So let's make sure that you don't need any. Blood test, no need. Okay, so let's do a thorax percussion just to make sure that he doesn't need any pain medicine. So look at that. First of all, this guy, this woman, I guess, is actually doing something under the draperia while his whole chest is open. He has his eyeglasses on for an eye surgery. Are you serious? I mean, I could make a whole video of this. Like, it would take a 20 minutes video to actually point out all the things that are wrong with it. And let's see actually what's on the monitor. I cannot really see it, but it doesn't look like an eye. What is that? Can you guys make it up? Like, maybe if you have bigger monitors, what actually shown on the monitor? If you can, please leave a comment below and let me know, or tell me if you're here. But, you know, in any way, I really would like to know if anybody can see what is happening. But come on, this is a disaster. What is literally open chest, eyeglasses on, doing something under the traperia, and he has an eye surgery. That's crazy. All right, Paul Harris, hospitalized, idle in bed. So he finished the defibrillation, which means that he is stable. He's still getting some analgesics. It's time to actually figure out what the heck is wrong with him. Okay, we did a few things already. I believe we need to do... It looks like a lot of things are all about his chest, right? I mean, we have like 10 pages, but it's almost everything about chest. So, I mean, chest pain, obviously, so makes sense. Should we actually do, well, CT or X-ray, or we cannot do a spirometry because there is no spirometry right here, which is annoying. So we have to deal without that. Have we checked his... Yeah, we have checked his temperature. MRI or echo angiography. Did we do any of that? I would actually do that because those can actually lead to death. I mean, they can be big problems. So let's actually do some heart checking. What is it? Angiography and echo. How about that? He's already stable. He's in the hospital. He's stable, so he should be fine. Angiography. There you go. And where is the echo? I think we can. I think we cannot have a normal echo, but we can have an urgent echo. Yeah, we go. Echo is not available. Did we do an urgent echo already? No. So it should be. Here you go. An urgent echo. We can do that. And maybe we could do heart monitoring. He is in the hospital, so in the hospital bed we can do that. Okay, let's keep watching the eye surgery through the chest. I mean, just imagine, that's probably a breakthrough kind of technology when you do an eye surgery through your chest cavity. Yes, I definitely would like to read some interesting articles about that in some magazine. Okay, so this one is again a general surgery problem. Let's see how many people are in the general surgery. I think we have a ton of people right now there. So we have to be kind of careful about that. Look at that. 1, 2, 3, 4, 5, 6, 7, 8, 9, although only 6 of them as patients. And let's see, any treating? Nobody is being treated. So how about here? Relatively, it's a lot, but relatively speaking, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Mark Scott was number 12. 13, 14, 15, 16. So we have exactly 2 patients per doctor. Are there anybody like treated? Yeah, one. I only see 1 person being treated. That's not a lot. So I'm just thinking, should we just fix him up right here? The problem is that there are a ton of things that he has to do, so I don't know. I'm still gonna send him over. Or there are 2 possibilities. Either I send him over there, or I put him into observation here, because it's already 2:52. He's never gonna finish that. I don't think so. But at the same time, we already have what's wrong with him. So if we do an ECG, a blood pressure we can do very quickly. We need to do a blood test. I'm not sure if there is enough time for that. Neck palpation, sure. It's a general surgery, so I think we need to put him into general surgery hospitalization and fix all of that, and then he can leave tomorrow morning. I think that's the responsible thing to do. Although, how about if we try quickly and let's see what's happening, okay? We can send him a bit later. Let's do a blood pressure. And a neck palpation also. So we're gonna do all these things right now. Neck palpation, blood pressure, and the blood test. And let's see, either we put him at the very last moment, we put him in the hospital, or we quickly finish everything. So let's see what we can do, okay? Go. In the meantime, the surgery is going on, but okay. Sarah Harris, look at that. Everything is good. Everything is handled. So ophthalmoscopy. Oh, you cannot do anything with the loss of vision. That's the problem. So just go home. Thank you so much. Bye. And we got another patient that we treated. Awesome. Okay, Kate Young. Why are you back again? Oh, thorax percussion didn't show anything. All right. I think it's finally time for you to just get treated. You're gonna need some iron supplements. You do need your broncholitis. No need. Fatigue, no need. Crumbling, no need. I think they are all low, so no need for anything else. Basically, that's all you got. Just get treated. Thank you. Oh, finally, at least he's touching his eye, but the eyeglasses are still on, which is still a crazy thing if you ask me. Okay, so the surgery is still going on. We still have a little time, but come on, guys, pick it up because we have a lot of other things we are taking care of at the same time. Frank Hill, you have amoebiasis, Crohn's disease, or ulcerative colitis. Again, 2 of them are general surgery. General surgery is getting swamped right now. Let's suppose that it's internal medicine problem. Okay, what would we need to do? We definitely need to do a physical. And what else can we do here? Physical. We could do a CRP because that's quick. Let's do an abdominal palpation, okay? If that could like differentiate between these two, hopefully. Come on, J. Martin. Interstitial nephritis. Okay, all you need is some antibiotics. But you might have a ton of other problems what we don't know about. So let's do a physical for you. And Blood test? No, he doesn't need dialysis. Oh, shit. Uh, you're telling me that if he does a blood test, she might turns out that even though she doesn't need, she just need antibiotics, she might need a dialysis? Oh, gosh, that's not good. All right, you know what? Let's do a urine test. Physical, a urine test. If I find it, because there are so many, I always miss the first time. Here you go. And what else? You know what? Let's do a blood test as well then. Blood draw. There you go. Okay, so the problem is that if she doesn't come back to me before, oh, look at that blood on the floor when they are doing the surgery. That's crazy. Okay, poison evaluation sunburn. You still don't know? Oh, no, this is a new one. Okay. Uh, let's just do a physical and the temperature and then take it from there. Performing eye surgery still. Oh, no, that's not the one. Hold on. I wanted to click on him. I want to know how he's doing. Hospitalized and treated. So far, I think he's okay. Robert Hall, we know that you have good contusion. Okay. Then you just simply treat here, Donna Harris, which is gonna be a numbing ointment, bandage, some analgesics for sure, pain medicine, ice wrap, I'm not sure. If you need that, swelling, no need, it's a small one, low, low, low. So all you get these and that should be enough for you. So let's hope that Margaret Young is a good eye surgeon. I mean, she's not. She's only 21%, but still, let's hope. Robert Foster, you did CRP and it didn't show anything. Okay. Hmm. Headache, fever, and fatigue. Um, let's do neurological testing. Uh, we already did chest auscultation and all of this stuff. Uh, you see, this is the problem. I do have spaces for these people. This is only 3 o'clock. I don't want to do something that takes really long time. I want to be able to catch him and put him into the hospital bed if necessary. So look at that. He might have some nasal cavity issues and stuff like that. Let's do. I'm really not sure. I try to do the simple things first. So let's actually do abdominal, neck palpation, oral cavity, and nasal cavity. I'm pretty sure that all of them are somewhere here in the 5 pages of problems. And if not, then so what? I gave him something that was not necessary. Rachel Barkley, if you finished the steroid cream, everything is taken care of, so go home. Alright, and the surgery is still going on. She is going back and forth between the monitor and the patient. That's actually kind of interesting. I don't know what's going on. I don't know how long a surgery takes, actually. I'm really wondering. Okay, broken ribs or chest contusion? You do have a chest injury, which is kind of bad. But I would do first, I would do a physical and I would do a... Can you do a... Yeah. Oh no, you don't have differential. You can do a surgery, but you cannot do a differential. So go over to Mark and do a differential. Because I want to avoid having to send you some kind of X-ray or whatever. Go ahead. Okay, apparently they are already stitching him up. But I never had a surgery before. That's why the title is my first surgery. So it's possible that every single surgery is done exactly the same way, So basically they would have, open the chest and put some mask on him and just be around. Could be, I don't know how it works. A lot of blood on the floor, which if it's an eye surgery, I would be very concerned about. But again, like I told you, like if it's an eye surgery, the whole thing is kind of crazy already. Okay, so this guy had a ton of different things gone for him. And we still don't know what his problem. At least we know that he's definitely a neurology issue. We do have a bed in neurology department, okay? So let's keep that in mind. We already did though pretty much everything. Like what else can we do other than microbial? Did we do that? I think that's the only thing that we haven't done, a microbial testing. Oh, also an MRI. Let's do an MRI, that's quicker. If we haven't. Have we? Oh, we did an MRI. Oh gosh. So even did an MRI, perimetry, ophthalmoscopy, physical. We did everything other than microbial cultivation. So I think we have no choice. How about if you do a differential? Would that help? Okay, try to do a differential first. Okay, that should be quick. Frank Harris. Pulmonary embolism. That's actually a pretty serious sickness, if you ask me. And probably would need somebody to stay in the hospital, but I don't have hospitalization here, so I'm not going to do that. Now, let's do the most important things first. Let's do a blood pressure management, blood pressure measurement right while he's still in the office. Of course, I missed it again, as always. Here you go. And ECG a bit later, and geography a bit later. Let's do a speech listening. Let's do physical actually. And a speech listening. Basically, still in the office, we're gonna do all this and the temperature. Okay, so we're gonna have blood pressure, physical, speech, and temperature management all in the office, and then we're gonna send him out. We don't need to have an angiography because that is basically what would determine that he has this problem. But he might need to go to an ECG. Actually, I'm gonna send him to an ECG for sure to check on if he needs any beta blockers. Okay, but I want to see how long these things take because if necessary, I put him in the hospital. Although it's only 3 o'clock, so it should be fine. Maria Garcia, okay, so we did an X-ray finally, and you have ankle contusion, which Elizabeth Hernandez is more than happy to handle for you with some numbing ointment and leg orthosis. Yes. We don't need these, I believe. I mean, swelling, warm, not a big deal. Actually, ankle contusion is small. It's actually the real thing that we are dealing with is the ankle injury, and the rest is like whatever. Okay, no problem. You do that. Okay, look at that. He's done. Okay, she's already saying everything is okay, almost done, and apparently we're gonna be able to. I was worried that we cannot actually finish our first surgery because time is running very quickly, but seems that we can. Okay, so Lisa Young, actually we did a nasal and oral, and it turned out We found what your problem is. This is the problem. Now, what else can we find out? If you have oral cavity, we already did that. Physical. Neck palpation would give you analgesics, but you already... Oh, no, you don't have them. Okay, so let's do a neck palpation, just in case. And an ear exam. I don't want to spend that much time on that. Ear exam. Actually, you know what? Let's just do a neck palpation. And then if it doesn't turn out any necessity for pain medicine, then we're gonna do. Look at that. She's done. Done. Look at that. He got the eye surgery. Visual field limited is not gonna be better than the closed angle glaucoma. I mean, he finished. Okay, look at that. We're gonna get $4,030 from this one person. So actually, yeah, surgeries pay. That's for sure. All right, what do you have, Frank Hill? Amoebasis, Crohn's disease, and okay, we had this before. We did abdominal and physical. Nothing showed up. Let's do a CRP testing. I think we might end up having to do a microbial thingy. Question is, how long do we have to wait for that? Okay. All right, you do it, Kate Young. She's all good. Everything, everything is suppressed. Okay, everything is good, so she can go home. Perfect. We have 10 patients done already. Lisa Young. Okay, so neck palpation actually shows that she has a painful lymph nodes, which means that she's gonna get the pain medicine, which means that I don't even need to do an ear exam, because regardless if she has pain over there or not, she's gonna do that. So let's just treat her. We're gonna give her the rest, which is the main thing. We're gonna give him the fever medicine, NSAIDs here, right? Fatigue, rest, but we already give him. Dry cough is too low. That one would also be NSAIDs, I believe. No, it's analgesics, sorry. The pain medicine. This one is NSAIDs. This one is just rest. All right, you're good. All right, and let's see what's happening here with our friend Daniel Hernandez, that apparently we finished. Okay, so irritable bowel syndrome. You see, she's all good. Less with analgesics. Why are you still even doing a stool analysis? We don't need that. Okay, you don't need to be in the hospital, and you don't need a stool analysis. So I don't know what's going on. Les was analgesics. I think we just have to just keep him there. Like, okay, there is nothing else I can do. Okay, Robert Davis kidney stones, and we did the physical. Okay, now this is the guy that I'm like, actually no need. Again, we can just simply treat him, I believe. Abdominal palpation would give him pain medicine. Does he need any? Yes, we already got it. Urine checking, no, this would be physical. Urine would give him antibiotics. Are we going to get antibiotics for anything right now? Actually, no. So that's something that we probably have to do, urine analysis, but its time is 3:13. Do I need to put him, but how many hospital beds do I have? I'm out of hospital beds here already. Actually, it's easier to find a different way. Hold on. This is not that. We go to General Hospital. We go down one floor, and there you go, General Hospital. And we push this one, and it's going to show us there is only one hospital bed remaining. Okay, one more hospital bed remaining. Do we want to put him there? Not really. But at the same time, I really want to make sure that he is good and done. So let's do a urine analysis. And worst case scenario is basically he has to come back tomorrow. But if he has enough time, then we just put him in bed if necessary. Or, oh wait, we did a urine analysis. What are you talking about? Never mind. So abdominal pain, physical, urine, we did that, physical. Okay, what am I talking about? Just simply treat him. Um, I'm afraid that they're gonna put him into the hospital bed. So I'm just gonna treat it myself. I'm gonna say, let's do a shockwave, little whatever it's called. Let's give him the pain medicine. Let's give him the fever medicine. Rehydration. We need to give him the stomatics. No and no. I think we're good. So let's just give him this and he's gonna be fine. I'm not gonna clog up a hospital bed for him, sorry. Patients needs to be hospitalized before treatment. No, he doesn't. Oh, bloody hell. Okay, then we have to have a regular hospitalization. Alright, you happy? Alright, okay. So we have again, oh, wait a minute, where is Hernandez? Is still in the... He's still laying down there. Let's actually see what happens to him. But Karen... So we have actually kind of clogged up our beds in general surgery already. So we are getting these issues right now. So let's see. Poison ivy rash. Let's do a chest auscultation just in case. Okay, so are you gonna go away or not? Oh, they are kind of waking him up, I think. Yep, everything is good. Look at that. He's done. Oh, yeah. So this episode really became the first surgery. Karen Martinez finished. He doesn't have any problem there. So let's just treat him. Jennifer Harris, you just treat her, please. Eye strap, no need. Antihistamines, no need. Okay, and Mary Hill. Migraine. What do you need there? We did physical and abdominal. Let's do neurological, speech listening, because now we already know that this is your problem. We can actually go specific things. We can check specific things that you haven't checked before. Odometry, we already have the eye drops because we know that he... Why do we have eye drops? That doesn't make any sense, but let's do an odometry. If I find a damn thing. Ear exam should be next to odometry, but not odometry. Oh, I cannot give him odometry. Never mind. Then that's all what you got. Okay, so you do those things. Thank you. And I believe this guy is going to be taken out. Now, before we finish, because I actually have to finish it here, one thing I realized, because look at this. I will have to do one thing here. Where is... I set up here... how big is this? 1, 2, 3, 4 times 6. Okay? Now, normally I'm doing it myself, but this time I'm gonna try to do a, what is it? Rooms. This is neurology, right? This is neurology. And I'm actually gonna use a pre-build cleaning closet, 4 times 6. I don't normally do that. It is a much nicer cleaning closet that I ever used. So this department is really well treated. And I have to hire some cleaning people. Okay, I'm not gonna get anybody with depression for sure, or drunk. Let's see the other ones. Let's just get this one. She's smart. Okay. Okay. All right. So because we have to clean up for sure. I mean, look at that place. It's blood all over. You see? Okay, Michael Foster. Oh, hold on. Did we finish that one? Yeah, we already did. So let's go for Mary Hill was okay. Michael Foster. All right, I'm not going to do anything about it. So basically, we finished the surgery. I have to go, guys. Finish the surgery, so it's done. We got somebody to clean up after that. We actually, at the point when we have to really consider our evening, but the problem is, as I showed you, we have a ton of people. We have 9 people in the hospitalization, which is actually a good thing because we have a lot of hospital staff, so at least it's going to pay for it. But at the same time, not much wiggle room left for the end of the day, so we might even have to build more hospitalization rooms or something like that. We will see. But that's going to be next day. But I think next time what I'm going to start with is quickly go through all of them and make sure that whoever needs to be hospitalized is hospitalized, excuse me. Otherwise, we're going to run out of the time again. At least with our first surgery, it seems that he did well. I don't know. They were like showing the thumbs up, so should be. We'll see how what's gonna happen. I believe they're gonna take him back to the HDU. I'm pretty sure about that. We will see it next time, guys. So thank you for coming, and let's actually save because that's that thing that I never do, and it's really bad. So surgery done. Okay. And don't forget to, if you like what you saw, please don't forget to hit the like button. Not the like button, like that's this one. The like button. Don't hit the subscribe button if you haven't subscribed yet. And don't forget to check out my other videos as well. This is a long series already, so you could check how we actually got to this one. This is going to be a mega hospital at the end of the day. And also I'm playing some other games like the Medieval Village Builder, Ostrich game and stuff like that. So check that out, please, if you want. And I'm going to see you guys very soon. Thank you so much. Bye-bye.